As the Pfizer vaccine awaits FDA approval for young children, some parents are still weighing whether to give their kids the COVID-19 shot. In a piece for The Atlantic, Dr. Aaron E. Carroll explains why some parents are resisting and what he says we need to do as a country to make sure children are protected against this disease.
Dr. Aaron Carroll is with us now to discuss the article. He's a professor of pediatrics at Indiana University's School of Medicine. I think this is a really interesting topic, Doctor, and I can admit, maybe several months ago, when contemplating the idea of getting my kid the shot, she's 10 years old, it kind of made me nervous, increasingly as I got more information, and not just about how safe the shot is, because I got it, but also about the risk of not getting it. I've become much more comfortable with it once it gets approved for kids under the age of 12. What kind of conversations have you been having with parents who are hesitant to vaccinate their children?
Well, we've always been having these conversations as pediatricians because as new drugs and new vaccines appear, there are, of course, always people who are on the fence about whether they want their kids to be the first one out of the gate to get something that is new. That happens with every vaccine we've introduced in recent years, with varicella in the late 90s, with HPV more later on, and of course now we're going to have the same thing with COVID. I think we had a natural assumption that when these vaccines were approved for adults that they were going to get taken up quickly and we would see the end of the pandemic. That clearly hasn't happened. I think the same kinds of things are going to occur with kids, and perhaps in even larger numbers than we expect, because parents in general are pretty risk averse when it comes to the health of their children.
In your piece, you write that in order to convince parents, we need to, quote, use the tools they trust. So explain to our viewers, what are some of those tools?
Well, I think one of the things that we saw with rolling out the coronavirus vaccines is that we did not use the places that patients usually get health care. They were not really done in physicians' offices. They were not done in the usual practice of care, which is where most people normally do get their vaccines. When we think about kids getting vaccinated, they almost always get them at the doctor's office. They get them at checkups. They get them at well-care visits. But we have not really talked about that or prepared for it, which has taken the ability of pediatricians to be trusted voices in talking about why the risks and benefits are such with the vaccines that most kids should probably get them. Without those kinds of trusted voices and the usual methods by which we talk to parents and families about what to do for their children's health, we'll probably have lower uptake than we otherwise would. I'm sure that we're working to try to figure out how will we get kids vaccines, but I'm not hearing a lot of talk about letting doctors' offices or, again, those usual methods by which we distribute vaccinations be used, and I think we really need to talk about that.
You have written about hesitancy, and you say, it's not uncommon throughout history. In your article, you reflect on the chickenpox vaccine and that, parents initially were not really that into it. They weren't sure if their kids really needed the vaccine. I would think that part of it has to do with the fact that many of us got the chickenpox and we survived. It was inconvenient, but we survived. In 2018, the CDC found, though, that around 90% of kids had been vaccinated, that eventually the population came around, but it was a slow uptick. Part of the challenge with this COVID shot is we would like everyone to get it immediately so we can reach some sort of, group immunity. But parents have a tendency to kind of slowly warm up to the idea of a new vaccine.
Well, they do, and they also have a limit. There's two things I think we can learn from the example of chickenpox. One, a lot of people view COVID the same way, correctly or incorrectly, that for most people, especially most kids, it is a disease they do okay with. The experience of most people who get COVID is that they're fine. Unfortunately, it still has a very high death rate, especially among the elderly and the immunocompromised and those with chronic conditions, so that it's incredibly bad. But still, there's a lot of people who view it as, well, for my child, it will probably be much less severe. I think the other thing, though, that we can take home from the example of the chickenpox vaccine is that the way we finally get to 90% is we start mandating it in schools. In fact, most of the vaccines where we have very high uptake rates in the United States are there because we mandate them in schools. And eventually, if all kids get vaccinated, then they become adults who are vaccinated. For vaccines we don't mandate in schools, take the HPV example, even amongst young adults, very few, 20 to 25% of like 18 to 26-year-olds are actually vaccinated against HPV versus something like chickenpox where it's now about 90%. So we can get higher by working with parents, and we absolutely should. But the ways that we get to very high levels of vaccination almost always involve mandates of some sort.
So, Doctor, you warn that unvaccinated people will likely not vaccinate their children. You stress that in your piece that vaccinating kids helps everyone around them. My question is what are the societal implications of not vaccinating kids? And I'm curious about it because, and I've been asking every doctor that comes on the air to talk to us about this, what their thoughts are. I keep going back to vaccinating children in the 1950s in the wake of the polio epidemic. And why I think about that so much is we know how many children and adults succumbed to that epidemic. And everyone that I've spoken to who was around during that time says that they knew someone who had been affected by polio. When I was a correspondent in West Africa, Nigeria was one of the few countries at the time that still had polio, that polio was not yet defeated in that country. It was only one of 3 countries. I would go into villages and I would see children who had been afflicted with polio and how they were suffering, how their parents were suffering, and how they hoped that they could get their hands on a vaccine that would prevent their children from being afflicted with this horrible, horrible disease. And I wonder if that is what it will take for people to realize that they need to vaccinate their children. In other words, we didn't see children getting sick. We didn't see a lot of children dying. And so for a lot of people, it's not an urgent matter.
So I think we can push it that way, and we should. And I think that's why when we have surges across the country, we see vaccination rates go up, because as hospitals fill up, as the news gets more and more dire, more people are swayed. But I also think it's important to understand that when we talk about polio, we talk about smallpox, we talk about the disease we've eradicated, it also eventually took mandates to get us over the edge. And those mandates were sometimes politically very unpopular. You can read news stories about people protesting against those vaccines. You can read news stories about even political violence because of vaccine mandates. There has been anti-vaccination sentiment as long as there has been vaccines. And what we're seeing right now, I don't think is that different. In fact, the fact that we've gotten up to this high level of vaccination in such a short period of time is actually pretty novel. But it's going to take continued consistent messaging from trusted voices working within communities to try to get the correct information to as many people as possible to get them to where we need them to be. But I think if we're going to really get up to the very high levels we want, eventually we're going to have to talk about mandates as well.
But so Doctor, then aren't we already or almost at the point where we will achieve some level of herd immunity in this country with the millions of people that have been vaccinated and the people who have suffered from COVID and who have survived and lived to tell the tale? I mean, we're never going to get 100% of the country vaccinated, I don't think. No. So would that be enough where we are now? I mean, yes, getting that extra push would be ideal, but if we don't, are we in danger?
So you have to remember that herd immunity is pretty local. We always talk about vaccination rates at a very high level, but outbreaks occur in smaller communities where vaccination levels are much lower. And in the United States right now, there are massive pockets of unvaccinated people, even as we achieve higher and higher levels of vaccination, because it's not a random 10, 20, 30% of people who are unvaccinated. They tend to congregate together. They tend to be, in certain groups. And so there are huge pockets still in many parts of the United States where massive outbreaks can occur. And as long as that is the case, there can still be surges and significant levels of disease. So we're also finding that some new variants are more and more transmissible. And of course, the more contagious a disease is, the more vaccination you need in order to achieve herd immunity. We will benefit, and I hate to use that word, but we will benefit from the fact that more and more people are getting natural immunity as well, as more and more people have been afflicted with COVID, and that does help when we talk about herd immunity and broad levels of population protection. But as long, again, as there are reasonably large pockets of unimmune people, there's still significant risk out there.
Doctor, I want to ask you sort of a final question about the bigger picture. Even before this national debate about the COVID vaccine, there were vocal pockets that were anti-vaccine. We saw sort of the emergence of, the measles and outbreaks of, diseases that we normally don't see in some school systems because there were that many people who had not inoculated their child. I'm wondering about whether or not you are concerned that the fact that we're having this debate, should you get it or should you not, as opposed to, the period that Vlad is talking about when people got the polio shot to protect themselves, but it was also the patriotic right thing to do. There were sort of these greater ideals that push people to get it done. I'm wondering if you're concerned, even if once we're past this epidemic, if people will continue to display hesitancy towards vaccines or this idea that they have the right to choose, and if we will find ourselves kind of, reaping sort of the negative implications of that.
I'm a little more cynical about this than some, in the sense that I feel like this anti-vaccination sentiment has been around for quite some time. Of course, with talking about MMR and autism, and a lot of the pushback against vaccination is one of the reasons we saw outbreaks of measles, because more and more parents were swayed against it. I think when we talk about HPV, it's come up in multiple presidential elections as something political, where people are not happy if and when we talk about mandating it, saying it could lead to promiscuity or that there could be other bad outcomes from getting an HPV vaccine. I am heartened by the fact that so many people so quickly have gotten the coronavirus vaccine. And I do not underestimate the effort it will take us to move this forward. But I think, again, eventually it will likely settle down into a steady state where perhaps we mandate it for schools and we work over the long term. But, we've had a hard time getting people to take a flu shot for decades. These kinds of issues have been with us for a long time. This disease is so contagious and so dangerous that it's more in our face than it used to be. But these are issues we have had in the past and that we're going to have to overcome as we move forward. It's definitely something we should invest in from a public health standpoint and something we should think about for the future.
Doctor, I don't think I've, in the course of the last 18 months or so, I've asked a doctor this question, but it's something that has become sort of interesting for me to ponder. And so you're my guinea pig as I ask this question about doctors and about medical science, right? It's not just people on the internet or on Twitter who are providing misinformation or what some might label misinformation. There are other scientists, other doctors who have opposing points of views about this vaccine and about the coronavirus. They are not high in number, but sometimes they have a very large platform, depending on the shows that they go on or the talk radio that they happen to appear on. And if you're an average person at home, that might be confusing. You hear one doctor who's got a very large platform, who may be on TV regularly or who may appear on the radio regularly, and they take an opposing view from you. My question is about engaging in good faith discussions about data and about science and about medical science in particular with doctors in your profession. Have you had those kinds of conversations with another doctor who said, here's my question and here's what I'm concerned about that seems to go against what Dr. Walensky or what Dr. Fauci or what the CDC says, and here's where my theory comes from and here's the science behind it. I mean, I'm curious about those kinds of discussions if they occur with doctors like yourself and others.
All the time. I think one of the dirty secrets of medicine that we don't talk about enough is how much uncertainty there is in general with medical practice. I think the public tends to believe that much of what we do is settled, definitive science. That's much rarer than people think. And so there's a fair amount of disagreement often, I think, in what is sort of best practice, which is when you get a debate about whether it's an art or a science, the practice of medicine. I think when it comes to vaccines, again, as you point out, there's general agreement on how much they work and how productive they are. And I'd argue that vaccines in general are one of the greatest public health achievements perhaps ever. In fact, it's often how we've eradicated disease. But physicians who disagree have always been part of the anti-vaccination movement. If you go back to the turn of the last century, I mean, the early 1900s, a lot of the anti-smallpox sentiment came out of medical organizations. When you look at MMR and vaccines and autism, it was a doctor in the UK who was the spearhead of much of that disinformation and anti-vaccination sentiment. I think what's different today is that people have bigger megaphones, and those physicians and scientists have bigger megaphones. And so it's easier to get disinformation than it used to be because there's just more outlets available. But I'm not sure that the level of disagreement or sentiment in the medical community is much worse this time than it has been in the past in similar circumstances. I think we just hear about it a lot more.
Fascinating. Yeah, it is really an interesting point to make. And now my goal is to go and research some of those doctors that you mentioned that were against what was sort of agreed upon by and large by medical doctors and scientists about those early vaccines to see what the argument was. I won't understand the science because I didn't do well in biology class in 10th grade, but I can maybe perhaps understand the arguments that they're making. And I think it'll make for some interesting reading, as did your piece in The Atlantic. Dr. Aaron Carroll, thank you very much for sharing those thoughts with us. Really appreciate it.
Thank you.